Hello, it's Naresh the orthodontist here, and for one of my first videos I wanted to begin, oddly, with the final part of orthodontic treatment, retention. Why? I think all patients should be aware of the commitment and the care needed to maintain an orthodontically aligned natural smile. Once teeth are aligned, some tooth movement will naturally occur. Retention is the phase after active orthodontic treatment intended to preserve tooth positions and your new smile. Retainers are broadly classified into two groups. Firstly, there is the fixed retainer, also known as the bonded retainer or the permanent retainer. These are passively and gently bonded or glued to the back of the lingual surfaces of your anterior or front teeth. Generally, I bond these from the canine tooth to the canine tooth in both the upper and lower jaws. My choice of wire is the braided rectangular wire. This type of retainer requires careful cleaning, but almost all patients find them comfortable. Removable retainers are known as Hawley retainers or beg retainers, but most popular known as vacuum formed retainers, known as VFRs. VFRs are clear plastic shells adapted to the tooth surface, popular because of its aesthetics and its ease of wear. VFRs are preferred by many patients for invisibility, and I feel as compliance is one of the major limiting factors in the effectiveness of removable retainer wear. VFRs tend to be my retainers of choice. All common retainers can be effective. The science becomes muddy, mostly because of bias and other commercial factors. In part because some studies accept quite a lot of tooth movement before they define tooth movement as unwanted. This is where I feel there is a key difference. The detailing phase of orthodontic treatment requires time and effort from both the patient and myself to introduce small corrections which transform a good case into a better case. I don't feel that after patients have invested in the detailing process that they should accept large tooth movements. Recent literature emphasises a trade-off between the effectiveness or stability and complications such as hygiene, wire breakages and unwanted tooth movements. I try to prioritise high-level clinical evidence such as systematic reviews, meta-analysis and randomised controlled trials. Also, large cohort studies and narrative reviews when I consider my retention advice. There is a limited but good evidence available. Several meta-analysis systematic reviews report superior maintenance of low incisor alignment front teeth with bonded fixed retention versus removable retainers. Studies find minimal clinical periodontal, which means gum disease, compromise when patients do maintain good oral hygiene and regular monitoring. And as a rule, I recommend bonded retainers in all adult cases unless there is a good reason not to. Within my private practice, I encourage patients to have removable retainers along with fixed bonded retainers, a sort of belt and braces approach. Next, I'm going to show you two short videos of a patient wearing two types of retainers. The first is of a patient who is wearing only a removable retainer, and as you can note, there has been some relapse of the lateral incisor. To rectify this, we have placed a bonded retainer and also continued with a removable retainer wear. And you can see clearly from this retention regime, there has been very little changes in the occlusion. For my patients, I tend to tailor their retention wear along with their needs and their starting or presenting malocclusion. I ask them generally to wear retainers during the evenings and nights for 6 months, and then only at night for another 6 months. After this year, I ask them to generally wear their retainers one night a week. For all bonded retainers, these need to be reviewed annually. This is often done by their own general practitioner or dentist, but is best done by a qualified and trained orthodontist. Hence I provide this service as I feel it's important to check not only the removable retainer, but the bonded retainer and between and around the retention on a regular basis. Using AI-based tools such as dental monitoring to review retainers is something I discourage. It often comforts the patient and the clinician, but in reality the software cannot see the bonded retainer. and produces, in my audited findings, false positives and false negatives. Other studies confirm the current unreliability of products such as dental monitoring. For accuracy and a more considered review, I recommend at least an annual checkup with your orthodontist. As a patient, you also need to be willing to help and take some charge of your orthodontic treatment. If you notice untoward tooth movements, contact your orthodontist immediately. If you notice a problem with your bonded retainer, wear your removable retainer on a full-time basis and seek help from your orthodontist. I hope this short evidence-focused video helps you understand how and why retainers are so important, and I thank you for your attention.